Healthcare is going to change in a number of ways over the next 3 to 5 years. First of all, it's going to become more personal. Therapies are going to be targeted more to your individual genetic makeup. There's going to be more assurance that the therapy that you choose will work, as opposed to some of the broad approaches taken now. The other change, and it's going to be a fundamental change, is that we're going to have to quit buying healthcare by the yard. Instead, we're going to have to pay for actual performance rather than just paying for a procedure. Pay to actually improve people's health. That really is the only way that we're going to bend the curve in healthcare. You know, the first thing that we're going to need to quit buying healthcare by the yard is the ability to measure and report on what happens in a hospital, in a doctor's office, and then pay based on that. You know, looking across the healthcare terrain, I see that Vangent is uniquely positioned to be able to help measure what goes on, help report, and in that way give the government the capability to be able to provide cost-effective reimbursement for therapies that really work. You know, we're still faced with emerging diseases in our society. And some people might be surprised, you know, when they look back on the emergence of obesity as a disease in our country. Disease doesn't always take on the character of, for instance, H1N1, which people would recognize as an emergent disease. Our biggest challenge as a society in hospital-based health is to be able to intervene quickly with interventions that work, to be able to stop a diabetes epidemic that's going to be vastly costly as we go down the many years and the many consequences of obesity, including diabetes. There are interventions that work. For instance, the H1N1 flu. The vaccine works. The trick in public health isn't the vaccine, it's getting people to actually be vaccinated and to follow good public health measures. And right now, Vangent is in the center of that by providing good public health information to populations about emerging diseases like obesity, like H1N1. The adoption curve has to be accelerated. And the way to do that is to make use of existing investments. The rip and replace strategy that some vendors are pushing is going to be costly, and the integration experience may not be pleasant. At Vangent, we're working with open architecture, with open source, and we have open minds about how to proceed. What does that mean? What does that really mean, open architecture, open source? It means you're going to be able to preserve substantially the investment that you've already made in electronic health records. We'll be able to work with what you have to connect it to the national network and give you the interoperability and meaningful use that's going to be necessary to achieve the President's goal. The first thing that we need to understand is that fraud is now a large criminal enterprise. It's not just, you know, somebody upcoding a claim. This is now the province of organized crime. To be successful, we can no longer be reactive to fraud. We need to change the way that we think about fraud and get ahead of it. It's been my experience that our fraud detection techniques have typically been a year or so behind those people committing fraud. We need to use high-level computing, statistical analysis to be able to move ahead and predict where fraud is going to occur and not wait for it to occur. You know, when you're in those positions, you're absolutely overwhelmed with information. The problem for the senior executive is to be able to take that information and to translate it into action. And what we're really looking for as senior government employees, what I was really looking for was, tell me the information that I need to know so I can take action to improve the program that I'm administering. Information's one thing. The government collects information for all kinds of purposes. But what the government senior executive needs is actionable information, and that's what we're committed to providing here at Vangent.